You may have had the same doctor for years, but a time may come when he or she retires or your health plan changes. Baptist Health Senior Services Manager Linda Finley is here to help us choose a new primary care physician. And this really can be quite a big job for people.
Absolutely, and it's one of the most important things you'll do, and is choosing your physician, because they're going to take care of you.
Yeah, it can be confusing, and just knowing the right questions to ask and what to look for. So we're going to go over some of these questions, and you can kind of talk with us about how each of these areas are important. First of all, I think one of the things is, well, that's the first question, does the physician accept your health insurance? But as we even get into these questions, there are gatekeepers, so to speak, as you're deciding on what your primary care physician is going to be. Tell us about a little bit about those, who those are, what you need to consider there.
Okay, well, there are 3 different types of physicians that are considered primary care physicians. First, you have geriatricians. They see just senior adults. Then you have internal medicine doctors who see just adults. And then you have general or family practice physicians who see everyone. And in choosing that, you need to understand that geriatricians, there are very few of them in the market. Most of them are in academia. There's more internal medicine physicians and a lot more general practice or family practice physicians, but they're all gatekeepers to other healthcare needs. If you need to see a cardiologist, you have to be referred by your primary care physician. So the first physician you want to get is a primary care physician.
So making the choice of which of those categories and which of those type of doctors that you need. And then as we mentioned that first one, does the physician accept your health insurance? That's huge.
That's very huge. If you have a physician and you're thinking about changing your insurance plan, make very sure before you do that he accepts your insurance that you're considering. If he doesn't, then there's kind of your answer on whether you want to take that insurance or not. If you really like that physician. If you're willing to move, then that's not so big an issue. But a lot of people really like their doctors, or they're very careful about whom they choose, and they need to be sure that their insurance is accepted there. Another consideration is, will that doctor's clinic file your insurance claims for you? Okay, they accept your insurance, but will they file them for you? And because if you're having to file them, that can get very complicated. And most of them do, but you need to ask.
Okay, well, this kind of goes in the line of some of these other questions. Is their office located near you? Is the hospital your physician uses covered under your insurance plan?
Another insurance issue,
And then, as you mentioned, will your physician's office process the medical insurance claims, or is that something that you're going to have to take responsibility for? I would not want to have to take responsibility for that.
I've had to. It's a hassle. But yes, in the same way that you're choosing a physician or a pharmacist, again, insurance is a big key. If your doctor only goes, well, if you get sick and you have to go to the hospital and you're going to have to go to a hospital you don't like or you've never been to before, and they don't go to the hospital that you want, then that's a consideration. Do they just not have practice privileges there? Could they get them? Would they be willing to? Or, you know, choose another doctor if they're not going to go to the hospital that you need to go to, or the insurance doesn't cover.
Yeah, a lot of considerations. And then another good question to consider, is your physician, I mean, this isn't a definite one, is your physician board certified in their field of expertise?
Yes, that is a question you would want to ask. And an easy answer for physicians that use Baptist Hospital, where I work, or Baptist Health, is to call Baptist Healthline at BAPTIST. Or 1-888-BAPTIST. If they call that number, they can answer those questions regarding our physicians.
And then we have some other important tips, because you know there just really is so much to consider, and the whole healthcare system is changing so much, and you have to stay informed and stay on top of things. But here's some other important tips. Make an initial appointment with any new primary care physician to determine if you will be compatible. When visiting with any new physician or a specialist, take your prescriptions with you, along with your over-the-counter supplements that you're taking.
That is huge.
Yeah, be sure that all of your physicians know what you are taking, prescribed and unprescribed, and then use one pharmacy.
All of that is so important, because for one thing, you waste time if you go to see your doctor and he needs to know what you're taking, so bring it with you. Bring the actual prescription bottle so they can see the milligramage of what you're taking and the actual dosages. And that saves time. It saves a lot of time, and that allows them to treat you better. You want to question, in that initial interview, you want to question them closely about how long it takes. If you've got just a lunch hour to see your doctor, or do they run behind a lot? You need to kind of know that. And you can ask your friends, too, that use that clinic. and just see how they are on scheduling. That's a good information. And, you know, meet the nurse, because that's who you're going to be talking to most of the time.
That's
so you
right.
Meet
That's
their
a lot
nurse.
of the face-to-face. Very good advice, very good information for us today. We appreciate it.
Yes,
All right.
thank you.
All right, thank you. We'll be back with more Positive Arkansas right after this. Don't go anywhere.